High triglycerides, causes and treatment. High triglycerides do not usually cause any symptoms. A person's doctor can advise on how often. They recommend a lipid profile test to check triglyceride levels. High triglycerides can indicate underlying issues and are a risk factor for several health conditions. In people with other risk factors, regular tests for triglyceride levels are important so that doctors can identify when they are raised and check for related issues, including high cholesterol. Dietary changes and increased physical activity often form the first line of treatment to bring down triglyceride levels. In some cases, doctors may also recommend medications to speed this effect. Risk of elevated triglyceride levels. Triglycerides are a type of fat. The American Heart Association note that triglycerides are the most common type of fat in the body. Although the body naturally makes triglycerides, some may come from the food that a person eats. After a person eats a meal, their body takes the excess calories that it does not immediately need and turns them into triglycerides. This causes the triglyceride levels to rise temporarily after a meal. The body can store these as fat to burn later when it needs energy between meals. Regularly eating too many calories may lead to higher triglyceride levels. If the body cannot burn off these calories and stores them as fat, the person may have higher triglyceride levels overall. Consistently high triglyceride levels may increase the risk of some health conditions, including atherosclerosis. In this condition, triglycerides mix with other substances in the blood, such as cholesterol, and stick to the walls of the arteries, causing them to narrow. Atherosclerosis is a risk factor for heart disease and serious cardiovascular events such as heart attack and stroke. High triglyceride levels may also increase the risk of other issues in the organs such as fat accumulation in the liver or pancreas. A buildup of fat may lead to inflammation and dysfunction in these areas if a person does not seek treatment. Severely high levels of triglycerides may cause pancreatitis. However, from research found that even mild to moderate high blood triglycerides, which the study authors defined as non-fasting levels of 177 milligrams per deciliter and above, are associated with an increased risk of pancreatitis. High triglycerides themselves generally do not cause any symptoms. The only sure way to identify the issue and seek treatment is to test for high triglyceride levels. A doctor will suggest when and how often a person needs lipid screening based on their age and cardiovascular risk factors. What are the different triglyceride levels? Triglycerides are a common fat in the bloodstream. They are a normal part of the blood and important for the body. It is only when levels get abnormally high that a person may be at risk of negative health effects. Testing reveals the triglycerides levels in the blood. As triglyceride levels increase, they fall into the following categories: moderate hypertriglyceridemia, 150 to 499 milligrams per deciliter; severe hypertriglyceridemia, 500 milligrams per deciliter or more; very severe hypertriglyceridemia, 880 milligrams per deciliter or more; Desirable fasting levels of triglycerides are less than 150 milligrams per deciliter. Triglyceride screening is typically just one part of a lipid profile blood test. The test will also check the levels of total cholesterol, low density lipoprotein or LDL, or bad cholesterol, high density lipoprotein HDL, or good cholesterol. Doctors may make specific recommendations ahead of the test. For example, they might ask the person to fast for 8 to 12 hours beforehand. What causes levels to fluctuate? Triglyceride levels fluctuate naturally in response to many factors, including calorie intake and time of day. Eating a meal can cause an increase in triglycerides, which the body may store to use later when it needs energy. These fluctuations are typically short-lived, but they are part of the reason why doctors may ask a person to fast before getting a lipid profile blood test. Some health conditions may increase the risk of higher triglyceride levels, according to the American Heart Association. This include having excess body weight or obesity, pregnancy, metabolic syndrome, insulin resistance, diabetes, hypothyroidism, kidney disease, inflammatory diseases such as rheumatoid arthritis. In some cases, a person may have inherited genes that predispose them to high triglyceride levels. Overall diet trends may also affect blood triglycerides, including excess sugar intake, especially from processed foods, which tend to have added sugars, higher intake of saturated fats, alcohol consumption, excess calorie intake. Some medications may also be responsible for changes in triglyceride levels. This may include diuretics, steroids, beta blockers, hormone medications, immunosuppressants, drugs. Anyone who is uncertain about the side effects of their specific medication should speak with their doctor. Treatments. A person can use a few treatments to help lower their triglyceride levels. Diet. Eating a healthy, balanced diet and exercising regularly are key to maintaining healthy blood triglyceride levels. People can adopt these measures immediately to bring their levels down. The National Heart, Lung and Blood Institute note that doctors may advise making these changes before they prescribe medications. Especially, they may recommend that people reduce their intake of sugars, alcohol, foods high in saturated fats, foods high in trans fats. A report in the journal notes that a focus on a heart-healthy diet can help bring triglyceride levels down naturally. A heart-healthy diet emphasizes vegetables, fruits, whole grains, legumes, nuts, healthy proteins such as low-fat dairy, low-fat poultry, fish and seafood, non-tropical vegetable oils. A person can adjust this diet to suit their calorie needs and food preferences. Exercise. Exercise is an important factor for overall health. It is an excellent way for people to burn extra calories and work out their heart and other muscles. The physical activity guidelines for Americans recommend that adults aim for a minimum of 150 to 300 minutes of moderate intensity aerobic exercise a week. If a person is new to exercise and feels as though they cannot accomplish these goals, they can consider working with a doctor or physical therapist. These healthcare professionals can help create a workout plan that gradually introduces exercise and builds it up to these recommended levels. Medications. Doctors may sometimes recommend medications to lower high triglycerides. They may do this if changes to diet and exercise prove ineffective, or if it is critical that the person get their triglyceride levels down quickly. In these cases, doctors may prescribe medications such as prescription strength fish oil, statins, fibrates. Each of these medications has its own effects and may interact with other drugs. A person should make the doctor aware of any other medications they are taking so that the doctor can create a treatment plan that avoids drug interactions. When to contact a doctor? While high triglycerides levels may not usually cause symptoms, anyone who is uncertain or concerned about their triglyceride levels should consult a doctor. Additionally, any adult who has not had a lipid profile test in the last 4 to 6 years should speak with a doctor about their cardiovascular risk factors and possible need for a test. Catching elevated levels of health markers such as triglycerides or cholesterol at an early stage may help a person make changes earlier to address the underlying issue.